what trend in RCM are you keeping your eye on right now, and why?
Paying close attention to data and analytics, and how well our executives in revenue cycle management are using data to inform their decisions.
Well, you certainly see a lot of information about social determinants of health and the movement towards value-based care. Our focus has been really on this, what I call interoperability with a purpose. And so that's to say the exchange of information for a specific use case is incredibly important and very impactful. In our case, we really focus on how we exchange information between legal requesters and the providers that are really just trying to provide care. So how do we do that safely, simply, and quickly?
I'm keeping my eye on the rising cost of healthcare and the increase in high deductible healthcare plans. If you look at the healthcare costs today, about 40% of Americans are delaying care due to cost alone, and about 55% of Americans are currently on a high deductible healthcare plan.
So we're keeping an eye on AI right now. It's being used today in some specific ways in health systems. So patient eligibility is a good example of that, or patient price estimation is another area that's being focused on. And it's starting to expand into areas like contract management and physician credentialing, areas where there's a lot of documentation that needs to be poured through and codified and then brought together for analysis on a certain periodic basis. But we haven't seen it as much where there's numbers involved. For example, patient billing or charge capture or coding, for example. So we're keeping an eye to see how quickly it can actually appear and be functional in those areas as well.
AI and automation are big trends we're focused on due to the staff shortages that all of our customers are experiencing. And digital front door and serving the patients with new technologies that allow them to self-serve is also an area that continues to be a trend.
Well, we focus on the patient financial part of RCM, and the trend we're focused on is helping the provider community understand that this trend, this issue around patient billing is not a problem for them to solve alone. This is a little counterintuitive because typically providers have been responsible for managing billing on their own. But when we take the consumer perspective, the consumer is not just getting a bill from a hospital. They're getting a bill from professional groups, lab companies. They're getting explanation of benefits from their insurance companies. They're even trying to navigate employer websites for HSAs, HRAs, FSAs. So there's a lot that consumers are navigating when they're dealing with a hospital bill. And so we're trying to help the provider community understand that it's not their problem to solve alone. We want to really help enable a full network of folks. And so what we're doing at Cedar is really bringing together those different players to create a single streamlined billing experience.
The biggest trend that we're looking at is the impact to the workforce with the implementation of robotic process automation and other AI tools, figuring out that you're going to move that workforce to somewhere else. How are you going to train them on the other skills or the upskilling that's going to be required? AHIMA is doing quite a bit of work around competency and task-based education. We've actually created several new micro-credentials that will allow individuals to learn new skills in a very short period of time, prove competency, and then be able to be put into new roles and do new tasks that are going to be the complement to the other tools that they might have been doing previously.
Right now, I'm really focused on denials. We expect to see an increase in denials in the next 6 to 12 months for two reasons. One, with the emerging technology with AI and LLMs, ChatGPT, that's being applied in multiple areas. On the physician side, we see it being applied to note writing, which is super helpful, but we also have this concept of hallucinations, where the data that's being provided and the results from the LLM are accurate, but the underlying information is actually non-existent. So that could cause a denial at the end of the day, so we really want to be aware of that. The second reason is payers are also using this technology, so it's giving them additional opportunities to identify potential denials, and that can be problematic. So at SmarterDx, our technology is not just based on the language models. It's also based on complex clinical data like lab results that really help us to kind of take it to the next level for our clients.
Well, we're keeping an eye on all of the AI talk, right? Everybody's talking about the bots that are automating things. And so we at Vispa are trying to differentiate between between what is automation versus what is truly AI. These terminologies seem to be getting blended. So while automation is important, true AI is predictive, right? You're trying to figure out outcomes based on the data you have. So at Vispa, we study what works well. So we look at all claims that got paid appropriately, the way they should have been, and then we can use that to predict what should happen with all these different variables in place. Something that you couldn't do just looking at it in an Excel spreadsheet and trying to figure it out on your own. Use advanced machine learning models to look at all the good data, and then you know when something is an outlier. So instead of studying what doesn't work, study what does work, and then predict what should be happening. And when there's an exception, you know you need to look at it.
Well, a lot of them, but the main trend really is the very high expectations and quest of personalization that the consumer, ultimately the patient, has with their healthcare journey. And I'm really not talking about just the clinical experience. I'm talking about pre-care, which could be the administrative engagement, as well as post-care, could be financial engagement. So we're keeping an eye on all of that. This year at RevSpring, we did a Voice of the Patient survey, and we talked to thousands of patients. What we learned was quite interesting. 87% of the patients said that they strongly have a strong desire to have their doctor or their provider talk to them in their preferred communication channel. What was really intriguing is almost half of them said that they would consider leaving a physician, leaving a provider, if they didn't get that administrative engagement or experience that they were looking for. 4 out of the 5 patients we surveyed also said that they have a stronger trust with their provider if they simply communicate in their desired communication channel: text, email, portal, phone, or print. So knowing the patient is critical and their preferences. I think it's a challenge and an opportunity for our industry to really know our patients and deliver the preferences that they prefer, and to meet these very, very high expectations. And we can do it through technology, through our intelligence, to know the preferences of the patient, to ultimately build better trust and loyalty, and then drive the desired outcomes that we all want and all of our patients want.
So I think, as we've probably seen with some of the sessions, it's around AI, and I think there's so much to unpackage, but I think it just adds to the complex situation that's out there with all the vendors and technology and solutions. And so one of the things we're trying to do is just keep an eye on, how do we help our clients support them in actually using these solutions, but finding the right way to do it strategically so that it fits together and they're actually optimizing the value, achieving the ROI, and creating a better patient experience.
Excellent. Thanks, Prashant.